Good morning, everyone, and welcome back to our podcast. Today, we have the lovely Sarah with us as we discuss the third stage of labour, specifically physiological versus active management.
Sarah, thanks for joining us. Would you like to just give everyone an update on you and where you're at with your pregnancy?
Hi, thanks for having me. So I'm 30 weeks pregnant with my first baby, and honestly, I didn't even know that I needed to think about birthing my placenta. I've heard about the third stage of labour, but I don't know what it actually means. I thought that once baby's out, it's done. I just want my labour to be as natural as possible.
That is such a common thought. Most people think birth ends when their baby arrives, but there's one final stage, the third stage of labour. This is when the placenta is born.
Let's take it back a step and talk about what the placenta actually is, because it's an unsung hero in pregnancy. It's an incredible organ your body grows just for this time. It supports fetal development by allowing oxygen and nutrient exchange, attaches to your uterus, connects to your baby via the umbilical cord, removes waste, and even produces hormones to sustain the pregnancy. When your baby is born, your uterus keeps contracting so the placenta can detach and be birthed either naturally or with some assistance. The way that happens is where different management options come in.
So, what exactly happens in the natural process of birthing the placenta?
So that would be a physiological or expectant third stage, and what happens is your body takes the lead. There's no additional medication administered, and the placenta is birthed naturally through the body's own contraction and maternal effort.
Your body releases a natural surge of oxytocin when your baby is born, especially if you're holding or breastfeeding your baby, which helps your uterus contract, separate the placenta, and reduce bleeding.
Yeah, that sounds pretty amazing. But can you guys tell me what the benefits of birthing my placenta naturally are?
There are several potential benefits. For example, a New Zealand study found that it may decrease the chance of losing more than 500 mils of blood. Also, women who have a physiological third stage may be less likely to need manual removal of the placenta, as it's more likely to come out fully intact. This can reduce the need for surgical procedures and any related discomfort.
Breastfeeding itself can help the placenta detach and be birthed naturally by releasing oxytocin and stimulating uterine contractions. It's also linked to a lower chance of postpartum hemorrhage.
That sounds great, but I watched this video on TikTok about it having bleeding risks, and I just wanted to know, is that true?
Yes, it's important to look at both sides. Some studies show mixed results. For example, a Cochrane systemic review, which are considered reliable as they compare multiple studies, found that natural management may increase the likelihood of heavier bleeding up to and over 1 litre. However, other research found that for low-risk women, physiological management actually decreased the risk of losing more than 1 litre. The difference often depends on the population studied, high-risk versus low-risk women.
If at any point things aren't progressing as we would expect, or if there were signs of heavier bleeding, we can quickly move to active management to support your safety. That includes giving medications like oxytocin at the time to help your uterus contract and reduce bleeding, rather than giving it routinely up front where there may be no immediate need. That's why the choice needs to be woman-centered, recognising your own risk factors, preferences and comfort level. For example, low-risk women like yourself without risk factors often manage the third stage safely without intervention. These risk factors can include anemia, history of postpartum hemorrhage, preeclampsia, or a medically managed birth such as C-section, induction of labour, or epidural.
You'll still be monitored closely. We'll watch your uterus, blood loss, and general well-being. If extra support is needed, medication can be introduced at any time, so you can start with a physiological approach and switch to active management if required.
So, if natural works for some women, why is it that hospitals recommend active management for pretty much everyone?
That's a fair question. Active management is often recommended because it can reduce the risk of severe postpartum hemorrhage, especially for women who are at higher risk. According to the World Health Organization, active management is recommended for all women to reduce the risk of postpartum hemorrhage.
Therefore, if you do not explicitly tell midwives that you want a physiological third stage, hospital policy is that you will receive active management. However, for low-risk women, studies have shown that physiological management can be a safe and positive choice, especially when supported by experienced care providers.
Let's walk through what active management involves and what that might mean for you. Active management usually involves 3 steps. The first, administration of synthetic oxytocin, either intravenously or via intramuscular injection. The second, cord clamping. If done too early, babies can miss out on some of their natural blood volume, leading to lower iron stores, but luckily, delayed cord clamping is now standard, usually between 1 and 3 minutes, which prevents most of these issues. And third, controlled cord traction, where the midwife gently guides the placenta out while supporting the uterus. Women generally prefer this stage, and it's more commonly recommended as it speeds up the process of the third stage.
Evidence shows active management significantly reduces the risk of severe postpartum hemorrhage. It can lower the need for blood transfusion, speed up placental birth, reduce maternal anemia, and make the process more predictable. In busy clinical settings or where there are medical concerns for mum or baby, this predictability can be reassuring. By reducing blood loss, it can also lessen fatigue and support quicker recovery.
Wow, that actually sounds really good. But what exactly are the risks?
That's a great question. Each part of active management does have its own considerations. The first, uterotonic medications, which is synthetic oxytocin. It's generally safe but can cause side effects such as mild nausea or a temporary drop in blood pressure. In rare cases, it can cause allergic reactions, or if contractions become too strong before placental separation, it may lead to manual removal. The second, cord clamping, if it does occur within 30 seconds, can reduce baby's iron stores and hemoglobin. And the third, controlled cord traction. This step should be done only after placental separation. If done too early, it could lead to partial detachment, cord tearing, retained placenta, or in rare cases, uterine inversion, which is a medical emergency and requires further intervention.
So I've been told that I have a low-risk pregnancy. So should I agree to an active management?
There's no one-size-fits-all answer. The best approach is the one that aligns with your health circumstances and values. Many women choose physiological management for a less medicalised birth, while others prefer the reassurance of active management to reduce bleeding risk.
Women consistently report greater satisfaction when they feel informed, involved, and supported in their decisions. You can always start with physiological management if that's what you choose, and if needed, transition to active management later.
Okay, that's a good point. But what about breastfeeding? I really want to breastfeed, but I just wanted to know, would the oxytocin injection affect that?
Great question. A systematic review found mixed results. Some studies reported a negative impact, some no correlation, and others mixed findings. So at this stage, it's not clear whether having the injection influences breastfeeding success. There needs to be more research in order to give you an evidence-based answer.
So, to wrap it all up, a physiological third stage allows your body to deliver the placenta naturally and can be empowering for low-risk women, though it may carry a slightly higher risk of heavier bleeding. Active management offers more control and generally reduces that risk, but involves medication and intervention.
Take time to reflect, talk with your partner, and bring any questions to your midwife or doctor. The most important thing is that you feel informed, supported, and confident in whichever choice feels right for you. Whichever way your placenta comes, naturally or with a little help, it is still your birth, your experience, and your choice.
Thanks again for coming along, Sarah. Congratulations again. We appreciate you being here and opening your mind to the possibilities of the third stage of labour. How are you feeling about all this information you received today?
Thanks so much for having me, guys. I've really enjoyed being on the show today. You've definitely given me a lot to think about. But seeing as I really want to have a normal physiological birth of my baby, I think I also want to have a physiological third stage too. I understand that my risks of bleeding could be higher, but given that I'm a low-risk pregnancy now, I think I really want to try a physiological birth. And if for whatever reason things don't go to plan, I'm happy to have an active management to help assist the birth of my placenta.
Thanks for joining us for another episode of Grad Dip Midwives Trying to Get Good Grades at Uni. We hope today's conversation makes the third stage of labour less mysterious and more empowering for every woman out there. See you next time. Bye.
Bye.